I guess we could say roundtable that is being hosted by Mayor Justin Bibb in the city of Cleveland to discuss issue 1 would be starting at 7 o'clock, and they started about 10 minutes early here. But this roundtable will be discussing issue 1, which is going to be on the ballot in 2 weeks here and across the entire state, and will in part deal with the future of abortion rights here in the state of Ohio. Now, he has a roundtable established of people and folks from the Cleveland Clinic to explain exactly what you're voting on, exactly the medical reasons behind where the law is right now and where the law will be. Let's take you live to that now.
Well, I'd love for all the doctors to introduce themselves and then kick off the conversation if we can.
Yeah, and I have just a quick ask of the press who are in the room. We do have a physician here who's a provider at preterm who has not gotten clearance from his primary employer to speak about this. So if you would not use his name or quote him, that would, or use his image. He's there on the sofa. Yes, he's there on the sofa. We will look to him for some input, but just to sort of help mitigate some of the challenges that he might face with his other employer.
The abortion landscape is so tenuous. A lot of us have like second jobs to make sure that we can still provide for our families and stuff. As much as we would love for this to be like this, I think by far is one of the most rewarding things I do at work is work here. But because it's so, you can't rely on it as
because you never know.
Exactly.
Yeah.
So we all have other jobs.
And let's start with you.
So my name's Dr Higgins. I'm a generalist OBGYN, and I'm not an abortion provider. I see a lot of patients and refer a lot of patients to the local abortion clinics here in the Cleveland area. I'm also very involved in medical education with our residents and do a lot of teaching and education around abortion and family planning related topics.
I'm Tani Malhotra. I am a maternal fetal medicine specialist, which is a high-risk pregnancy doctor. I perform abortions for my patients when they require them or they ask for them. So I have performed abortions, and I care for patients with a lot of pregnancy complications, whether they're coming into pregnancy with those complications or those complications arise because of pregnancy.
Mayor Justin Bibb.
I'm Mae Winchester. I'm an abortion provider here at Preterm Cleveland, and I'm also a maternal fetal medicine specialist at an academic center here in Cleveland.
My name is Emily Freeman. I am a OBGYN, and I'm also a complex family planning physician, so I specialize in some of the most complicated patients and most complicated abortion cases as a subspecialty.
And I'm Srita Kolapati. I'm the interim executive director of preterm, and I am trained as a sociologist with a focus on health inequity. So this feels really at home to be in this institution and to be having this conversation. And I love your shoes.
Yes. Vote.
Lots of these shoes have gotten lots of wear in the last.
Yes, it's certainly a great perspective to bring to this work. So, Dr. Higgins, let's start with you. In your words, what does issue 1 mean for you as a doctor?
So that's a great question. Issue 1, I think first and foremost, allows doctors and their patients to make these, life-changing, perhaps life-sustaining for the patient, to make these to make these certainly important decisions, these private decisions, these often difficult, but sometimes not always difficult decisions. We see a lot of the stuff with politics getting into the classroom, into the medical office, into all of these conversations that it should be between parents and their children, patients and their doctor. And the government overreach here is just, it's so difficult. As a physician, we do extensive amounts of training. We do 4 years of medical school, 4 years of residency, fellowships from anywhere from 1 to 3 years. Huge, and this is all post-college, it feels, with this government overreach, it undermines our training, it undermines the relationship with our patients. And so to go, as you mentioned, to go back to the kind of post-Dobbs world, with the heartbeat bill in place, it's scary, it's frustrating, because we know when abortion is banned, when abortion is limited, it's not that it doesn't happen, it doesn't happen safely. And passing issue 1 will allow us to provide indicated medical care, and that's what abortion services are. It's healthcare, it's medical care.
And people tend to forget in this very partisan, hyperbolic world in which we live in, people tend to forget that important point, that it's medical care, it's health care for women in our society. It's so important. Dr. Malhotra?
Everything that Dr. Higgins said, but for me, issue 1 keeps the lawmakers and politicians out of my exam room. That exam room is small. That exam room is filled with emotions and discussions that are personal and private to that patient and their family, and there's no room for people who've never been trained in medicine to have that discussion, to make a decision about what patients can and cannot do.
Dr. Freeman, I want to ask you the question around kind of your experience and how has the ban impacted patients?
Yeah. So in those, I think, 82 days that
Yeah.
we were sort of, forced to turn so many patients away, was really, as a provider, one of the most heartbreaking. Like, Ray, I went to medical school. Like Dr. Higgins said, went to medical school, went to residency, did a fellowships, just, specialize in providing abortion care. I'm an expert, I'm board certified in both. To be able to have to turn people away or, have them leave the state, and knowing that, it's already been addressed here, is that many patients can't leave. And so many patients were forced to continue a pregnancy. And in some situations, in a life-threatening type of situation. During that ban, we had limitations of who we could take care of. We took care of sick patients and were able to do that with, some of the exemptions, but there's so many patients that are sick, but they're not sick enough.
Yeah.
That are some of the most terrifying situations to be in as a provider, of being forced to wait till somebody's on the brink of death so that you can take care of them. It took an oath to take care of people and provide health care to them, and to be, have politicians dictating who I can see, what services I can provide, is truly heartbreaking and insulting. That somebody thinks, that makes decisions in Columbus is, deciding what my patient can have in terms of care and what I can provide.
Yeah. And politicians intervening with that oath certainly is not effective or productive.
Not at all.
Yeah.
Not at all.
Dr. Winchester, for you?
The question was what the
During the ban, during
Yeah.
the 80+ days we saw the ban, what did you see?
It was just heartbreaking. It was like nothing I had ever experienced as a physician before. And, I've trained in really red states in the past, and I've seen some horrible outcomes from patients who were denied abortion care. And it was really hard for the patients. It was really hard for physicians. I've never felt so burnt out before. There's a great moral injury that comes to what Dr. Freeman was saying, when you know what you should be doing and what you're trained to do, and you know what the right thing for the patient is, but you have to tell them no. And it has to be you. It's not the politician that's telling them no. It's not, the media telling them no. It has to be you as a physician, and that just digs at you and digs at you. And when we say that we can never go back, as a physician, I don't think I could ever go back to
I want all of you all to chime in on this question, but you know, Ohio has on the books, we have the injunction, but we have one of the most restrictive abortion bans in the United States. And we'll start with you at the end, Dr. Malhotra. What other unintended consequences have you seen, or will we see, with women in Cleveland, based upon having one of the most restrictive bans in the state, in the country?
I'm Dr. Bethel.
Sorry, so sorry.
But
Sorry.
I would definitely,
My apologies.
I would love to speak
Sorry.
to that. I would love to speak to that. And, you know, we not only have this 6-week ban, or the so-called heartbeat ban. I'm saying that because there isn't a 4-chamber in the heart, right? There's like just the beginning of these pain. Right, yes. So we also have a fetal tissue disposal ban. You know, our legislature spends much of their time in Columbus passing these bans, and the impact for people in Cleveland and Northeast Ohio and in all of Ohio, you know, we know from just our direct interactions with our patients that many of them, the reason that they're choosing not to continue their pregnancies are for financial reasons. And they have a hard time, even over half of the people who have abortions already have a kid. So even making time to come into the clinic is hard for them, taking time off of work. So it has this like really severe economic impact on people. It is, you know, I think like the potential for people to try, because of the desperation, to self-induce and have some kind of deleterious health effect is really strong. We also have extremely high maternal and infant mortality in Ohio and in Cleveland, and it's disparately impacts women of color and
I want to talk about that later too.
Yes, and so, you know, the most severe effects of these bans are on people who are the most vulnerable, who are already struggling with these poor health outcomes, not just mortality, but severe morbidity related to pregnancy. So it has, like, you know, just life, the ability to live healthily, to live with dignity, to live with safety. That's what's at risk, and that's the impact.
Doctor.
Yeah, you know, to kind of echo all that, I think, right, we have this injunction, and so many people think, oh, you know, it should be easy to get an abortion, and I think it's important to point out is that there is in no way, shape, or form is it easy to get an abortion in Ohio for patients. They jump through multiple hoops just to get to care, just to present to one of our, you know, clinics or hospitals. They are, it's a minimum of 2 visits, right? They have to come in, they have to sign consents. I'm mandated to tell them certain things and offer them certain resources that, you know, are not actually medically accurate. They, you know, have to then come back to get the abortion. And sometimes it's, you know, in other places where I provide healthcare, they could have it all in one day and it could be less burdensome. And I think it's important to note is that majority of the patients we take care of do not have insurance coverage for this. And majority of patients we know that seek abortion care need to pay 1/3 of their monthly income to have an abortion. So this is an incredibly, you know, a huge burden to patients, and especially patients that, you know, we're taking care of, like was already echoed, is, you know, they're already, you know, living well below the federal poverty line. They're already, you know, juggling childcare and schooling and work. We know that the majority of patients that we care for in Cuyahoga County are patients of color that are seeking abortion services, and they're already way behind in the wage gap, right? So to pay a third of your monthly income, and there are some resources, but they're not enough. And so I think it's important to know that even though we are able to care for people past 6 weeks right now, it's not easy.
I would just echo all of that. We've talked about the burdens of getting an abortion, and so when patients get to this point, I trust them. They have looked at our prices online, they have arranged childcare to be here, they have arranged transportation to get here, and they're certain in what they want. And I feel like a lot of times our patients get vilified. These patients are good parents. Most of our patients already are parents. I can't really hide my pregnancy now, and they're always telling me, congratulations, are you having a boy or girl? They give me advice. These are good people. Our patients are good patients, and we should not be trying to punish good people for making the decision they feel is right for them.
Maybe you both want to add to that?
I'm going to come at it from the perspective of someone who manages complicated and high-risk pregnancies. As Dr. Higgins said, Ohio is in the bottom 10 of maternal mortality and morbidity. And when we have patients that come in that are just not sick enough, or not sick enough yet, and telling them, well, if you just get a little bit worse, then we will be able to do your abortion, is just, it's an injustice. It's an injustice of so many proportions. And turning patients away, whatever their reason for an abortion is, to say, when you get to this particular point, when you meet a certain criteria, we'd be willing to do it. But the abortion ban that we have in Ohio, if issue 1 doesn't pass, has no protections for rape or incest. We had in 2022, there were 42 abortions performed on children less than 15 years old. Between 2013 and now, it ranges between 52 to 100 per year on that age group. I think turning away patients tells them that somehow their decisions are not valid. Their personal decisions that they made with their families, that they somehow don't know what the right decision to make is for their families. And that's dehumanizing for those patients.
Yeah, I think similar to what Dr. Malhotra said, as somebody who takes care of patients later in pregnancy, second, third trimester, deliveries in the hospital, long-term, antepartum stays, we see patients who maybe considered termination, couldn't get it at the beginning, and obviously we're way past that point in their pregnancy. They have, either been forced to or decided to continue with the pregnancy, and now they're experiencing life-threatening complications just from pregnancy, whether that's severe preeclampsia, growth restriction of the baby, any number of complications with the placenta, things that are risky to their life. I think one of the anti-choice responses to abortion is, well, you could always put the baby up for adoption. And I think one of the things that we need to remember is that pregnancy is not a health neutral event. It's one of the most dangerous things an American woman can do in her lifetime. And to just gloss over that and say, oh, just adoption is great. And it's great for some people, but it's not great for other people. And there need to be options. And so it's heartbreaking to see then, months down the line, patients suffering because they couldn't make a decision that they wanted to.
And Dr. Higgins, you mentioned an important point that I think it's incumbent, particularly as a male elected official, to say this, that a pregnancy for a woman is one of the hardest, most difficult things they'll ever go through.
And most dangerous.
And most dangerous. And we need to just call that out even more as we head to the polls on November 7th. So it's so important that you call that out.
Yeah, and it's scary, and it's scary as providers for us to, in those almost 90 days. I remember seeing a patient that had it was, I think I actually maybe even spoke with Dr. Freeman about it, that it was it was basically what is called an inevitable abortion. Somebody who is bleeding actively and in the process of passing the tissue, and I felt stuck based on the law. I was like, I know what's going to happen, but I don't know if I can treat her, if I can help her to help maybe prevent excessive bleeding, life-threatening bleeding that could end her up in the OR, back in the hospital, blood transfusions, because I felt like my hands were tied by the law. And as a physician, to say, do I need to call the lawyers first to check with a non-medically trained person to say, is this okay for me to do? When, like one of you said, I know what's right. I know what the right treatment is. But to have that kind of looming over your head, what will the lawyer say? What will the law say? Could I get arrested for this? Fined, whatever the case is.
As mayor of Cleveland, and thinking and reflecting on this issue, one of the biggest things that we're focused on, and why I'm so passionate about issue 1, is really making sure we address this from a racial justice standpoint. We know that Black women are 2 to 3 times more likely to die because of a pregnancy-related cause. And, we need to keep talking about that, particularly to ensure that all of Cleveland turns out to vote, but particularly in the Black community, they turn out and vote, and Black women turn out and vote. And I would love for you all to really reflect on, how does the potential ban exacerbate health disparities in our city? Start with you.
Abortion is an issue that has always impacted our communities of color and our poor communities, always since day one. Those communities often are less likely to trust the medical system in general, and for good reason. History has not, our medical history has not behaved kindly to minorities. And so we're already starting off at a place where minorities, people of color, are disadvantaged. And then we throw on bans that already affect systemic racism, socioeconomic. These bans affect the socioeconomic aspects of our patients, which are then going to disproportionately affect our communities of color. And we see it all the time, and it's usually very nuanced. But systemic racism is pervasive in every hospital in this state.
Yeah.
We see that in our outcomes, our maternal mortality rates, our infant mortality rates. Just based on your sheer zip code determines if you're more likely to live or if your baby is more likely to live after birth. Just your zip code. And the people that have money and connections are always going to be able to try and find a way.
Yeah.
They'll always find a way to be able to travel to wherever they need to go. But people who don't have those means, through no fault of their own, through barriers that have been in place since before they were born, are always going to feel the brunt of that burden. And that's who's going to be affected the most. And so we have to step up for everybody, for those patients especially, to make sure that care is always going to be available to them. This is the least we can do.
Absolutely. Anyone else want to reflect on that question?
Justice, reproductive justice, is about being able to choose when to have a child, being able to birth the child safely for themselves and for the child, and being able to raise that child safely. I think on so many levels we have failed minoritized and racialized populations, right? And I think when it comes to abortion access, I've had patients who can't make it to their clinic appointments, their doctor's visits for when they're getting prenatal care. And I've had patients who've said, this is not a during those 82 days and other times, who've said, this is not a pregnancy I can keep. We said, hey, you know what, preterm has a financial plan, but still requires a certain amount. They said, I don't have that money. I didn't have the money to come to this visit today. I don't have the money that is required for me to be able to get the care I need. I've had patients miss their prenatal appointments because they don't have cars. And then when we don't have access to abortion in the state, I can't ask them to go out of
Travel.
state
Yep.
because they don't have a car to get them to their doctor's appointment. And I think that gets lost. That those are the patient stories. Those are the those are the personal stories that politicians don't hear or don't care about, that completely gets lost.
You're so right.
I think sometimes there's so many burdens that our patients, our Black patients and our Latina patients face that, sometimes the path of least resistance sometimes is just to continue a pregnancy.
Just have the child. Yep.
Yeah, because they're like, just echoing everything, sometimes I feel like it would be easier for me to get somebody to Mars than it would be out of state to get an abortion, honestly, because there is so many barriers that people face, and, right, I live a life of privilege. If I need an abortion and if issue 1 doesn't pass and we go back to a 6-week ban and I need an abortion, I could be on a flight to Illinois in a second and have an abortion and leave that day. But I absolutely know the majority of patients that I care for could never do that. And even if they could get funding, right, they have to facilitate childcare. They have to, call off work. They might lose their job. There's just too many burdens, and so that sometimes it's just, I'll continue the pregnancy. And I may not be able to access, the prenatal care to what I want because I can't get, I missed the bus. I don't have a car. I don't have gas. I can't make a telehealth visit because I don't even have a phone to do a visit. So I think it's so important for us to realize all of the burdens that the patients face.
And I want to talk about criminalization as a issue that pregnant people will face, and the disparate application of laws on Black women and poor women. If we're in a situation where most abortions are illegal in Ohio, and if there are moves, I know one of the priorities of your administration was to deprioritize enforcement, and I think that's in Cleveland, but what about other parts of Ohio? We've had towns pass bans, and those laws are going to be like all the laws in the United States, disproportionately applied to women of color, people of color. So there's going to be additional criminalization. We have already seen it with people who have been prosecuted for miscarrying, that the people who get prosecuted for that are people of color. So, people could go to prison for the rest of their lives for trying to go out of state to get an abortion, for self-inducing an abortion. Self-induced abortion can be safe, but it can also be very risky, and that depends on who has information and who has access to care and who has access to money to get safe medication. And that's also going to be conditioned on race and economic access. So I think the disparate impact will have both medical and biological elements and social elements with criminalization.
So as we wrap up the conversation, I have 2 final questions. The first question is, Election Day is coming up soon. What else can we be doing to make sure we codify a woman's right to choose in the state constitution? Start with you.
All right, well, I think it's get your friends to vote and get your friends' to vote. We're a lot of our organizations, Ohioans United for Reproductive Rights, Ohio Physicians for Reproductive Rights, are doing great efforts to get out the vote, to do door-to-door canvassing, phone calls, writing letters. Door-to-door is one of the most effective ways that we can get our community to get out and vote and explain, that face-to-face interaction, hearing these stories, from whether it's physicians or other people who've had, everybody knows somebody who has had an abortion, and, sharing those stories and why it is important to pass issue 1. That's how we're going to get our community and our state to hopefully pass this issue.
Yeah, I think get the vote out, and also I think we all need to do our part in fighting disinformation. I think we've
So important.
seen
Yeah.
disinformation sort of, I mean, it's probably been around all along, but with COVID and then
Yeah.
all the things after, we've really seen it spike in a way that I had never seen before. And fighting that and challenging that disinformation is really important.
Yeah, I would agree. I think the misinformation has been terrible to see.
Yeah.
That this, especially with this campaign, you know, for example, like this issue 1 does nothing to change our parental consent laws. And so when you see those like, vote no, protect children, this law has nothing to do with changing parental consent laws. And if you really wanted to protect children, there are much better ways to do that. And then just making sure everyone, you know, has a plan to vote.
I would agree. I would echo, you know, vote early, vote, take a friend, take 3 friends, please. Just take whoever you can. Is super important. I mean, I don't think there's actually a more important election in Ohio that I could think of in recent history. This really hurts. There's so much on the line with this election. You know, Ohio already has trouble recruiting physicians, and I really worry that
Yep.
my colleagues will leave. I mean, you know, not only is it hard to practice medicine, but it's hard to live in a state where you yourself might have to leave to seek an abortion. So I think it's critical that people vote in this election because there's so much on the line.
I can't add, I think, more in terms of mobilization, but I do think in terms of disinformation, you know, this bill is about more than abortion. Abortion is a critical part of
Yep.
it, but people who want to do IVF, you know, other basic forms of reproductive technology and reproductive health care access are on this bill.
Miscarriage management.
Miscarriage
Yeah.
management,
Contraception.
contraception. So these rights, you know, abortion is perhaps the most contentious, but there are many aspects of living a full and free reproductive life that are protected by this bill. And I hope that other folks who are thinking about any of these things, contraception, IVF, know people who may need these things, will come out and vote. You know, it's a really the floor of what we need.
Yeah. I want to end on a optimistic note. So, start with you, Dr. Higgins. Right now, what gives you hope?
This panel, honestly, and truly seeing and connecting with so many of my colleagues in the Cleveland area, whether they're physicians or, you know, other healthcare workers, and just seeing the incredible amount of support for this issue. We've really, you know, abortion is often split along party lines, or it's made to be a Democrat versus Republican, or us versus them. But this is a human issue. This is a people issue, and it's been really incredible to see people from all sides of the political spectrum come together and say, this is not what we want for our state. This is not what we want for our communities. And so I'm just really encouraged, and, you know, seeing other states that are red or purple, you know, pass abortion protection amendments is amazing, and giving me encouragement that can happen here in Ohio as well.
Yeah, that's the most important part, but seeing it happen and succeed in other states is what's giving me hope right now.
I would say our patients give me hope every day. Again, I said, like, this is like the most rewarding work I do. And I know every day I come here and that I work here, I have helped someone, and that is whether or not that's helping them focus back on school, stay in a job that they really want to excel at, not be tied to some abusive partner, or help them focus on the family they already have. I see it in their face every single day when I work here. And that's something I'll continue to do as long as it remains legal in this state.
I would agree. I mean, I think abortion care is life affirming, it's life saving, and Ohioans know what's right for them, right? Like the most rewarding part of seeing this movement happen is Ohioans, you know, after Dobbs and after this really like 10 to 15 years sort of like slowly picking away at abortion access in Ohio. You know, Ohioans are pushing the movement, right? We have decided that, you know, the politicians have failed us in Columbus, and so I think us, you know, pushing for this amendment is us taking some of the power back that's been taken away from us. So,
you know, I think the vote in August on changing the threshold to pass a citizen-led initiative, the voters soundly rejected that.
Yep.
I have hope that Ohioans have a sense of fair play. You know, I grew up in this state. I received excellent public education in this state. And I know that many of the people who will come out to vote are the same as me, you know, that they have that kind of public civic grounding. And a sense of fair play, and you know, the August election really gave me hope that people see through this fog of misinformation and are guided by a real internalized sense of fairness.
Well, each of you give me hope. So I want to thank you for your courage. Thank you for your voice. Thanks for fighting on the front lines. I'm not on the front lines. You all are on the front lines every single day. And I'm looking forward to celebrating on November 8th with you all when we pass Issue 1 and codify abortion rights in the state constitution. So thanks so much for the time.
Hear, hear.
Thank you.
All right, so that is it from Mayor Justin Bibb and his roundtable.
That was so powerful. Thank you, guys.
Thank you.
Did anyone have any other questions?
Oh, let's see if there's any others.
Okay. Well, thank you all so much.
Thank you.
Thank you. Truly powerful. Did we want to take a few pictures with
So that is it from this roundtable hosted by Mayor Justin Bibb. You heard a couple of things here. Now, we're doing this on a day when we have had Governor Mike DeWine on our air talking about abortion and how he says that he wants people to vote no for Issue 1. So it is only fair to be able to offer both sides here, and particularly with top politicians in the state of Ohio. Now Mayor Justin Bibb joining this. Now you heard him mention a couple of things here. I'm going to hit on these quick before we let you go. Health disparity among different communities and different ethnic groups and minorities being a huge part of this. Lack of resources is a major problem. And the idea is, if we continue to restrict those resources, it's only going to get worse. So pulling back what we can offer is not the play, is the idea among this here. Now, Issue 1 very clearly would help to either increase abortion rights in the state of Ohio or decrease them, or at least offer the availability for that. Major issue. Major decisions to come on this November ballot. We're going to break this down much more tonight on 19 News at 10 and 11. I'll finish off with a look at the panel, again hosted by Cleveland Mayor Justin Bibb. Much more to come on this story and other stories of the day tonight on 19 News at 10 and 11, but our 7:30 newscast has just kicked off over on the CW.
19 News, now streaming on Samsung Smart TV. Search for channel 1035.